You wake up with a throbbing pain in your head. Not a dull ache, but a relentless pressure, as if something is trying to push its way out of your skull. You've had this feeling before, blinding migraines that steal your days and nights. For 99% of human history, this wasn't a hypothetical inconvenience you could solve with 2 ibuprofen and a dark room. It was a terrifying, debilitating reality that threatened your ability to hunt, to gather, to simply survive. Today, you might consult a neurologist, perhaps even consider surgery for chronic conditions. But imagine facing that pain when the best medical advice you have is a shaman, a sharp stone, and a desperate prayer. Your ancestors lived in a world brimming with danger, a world where a broken bone or a simple infection could mean a swift, brutal end. Every scratch, every fever, every persistent ache was a potential death sentence. Modern medicine, with its sterile operating rooms and targeted pharmaceuticals, is barely a blink in the vast timeline of human existence. How then did our ancient relatives manage to endure? What desperate measures did they take when faced with excruciating pain or life-threatening ailments? You might expect simple magic or pure superstition. But beneath the rituals and incantations lay a surprising foundation of empirical observation and ingenious, sometimes terrifying medical practices that actually worked. Consider the unsettling practice of trepanation. This is the surgical procedure of drilling a hole into the human skull. It sounds like something from a horror film, a barbaric act of last resort. Yet, evidence of trepanation dates back to the Neolithic period, with skulls found across the globe bearing the unmistakable marks of this ancient surgery. Why would anyone willingly submit to such a procedure? Archaeologists and anthropologists have long puzzled over the prevalence of trepanation. It was performed for a variety of reasons, from treating head trauma and epilepsy to relieving chronic migraines and even, perhaps, expelling evil spirits believed to cause mental illness. The key, however, lies in the evidence that many of these patients survived. You can see the clear signs of bone regrowth around the edges of the holes in their skulls. This remarkable healing indicates that the individuals lived for months or even years after the operation. In Peru, for instance, extensive research by physical anthropologist Dr. John Verano on ancient Moche and Inca skulls has revealed astonishing survival rates, sometimes exceeding 70% in certain periods. Imagine a surgeon today achieving such rates with primitive tools and no antibiotics. Your chances of surviving such a procedure might have been better thousands of years ago in the Andes than in some hospitals just a few centuries back. How could such a brutal operation be so successful without modern understanding of anatomy, hygiene, or anesthesia? Perhaps the simplest explanation is often the correct one. Relieving pressure on the brain, whether from swelling due to injury or from the intense pain of a migraine, offered genuine physical relief. But cranial surgery was not the only crazy medicine our ancestors deployed. Infections were a constant, pervasive threat. A minor cut could quickly fester, spreading bacteria throughout your body. Without penicillin or other modern antibiotics, how did they combat these invisible enemies? The answer often lay in the natural world around them, a pharmacy of surprising efficacy. Take honey, for example. For millennia, cultures across the globe have used honey to treat wounds. Your great-grandparents might have even used it for minor cuts. Seems simple, almost quaint, doesn't it? But honey is a natural antiseptic, rich in hydrogen peroxide and with a low pH that inhibits bacterial growth. It draws moisture out of wounds, drying them and starving bacteria, while creating a protective barrier. This wasn't some mystical belief. It was a highly effective, empirically proven treatment for preventing and treating infections. Then there's the less palatable but equally effective use of molds and fungi. Long before Alexander Fleming discovered penicillin, ancient peoples were unknowingly harnessing its power. The Ebers Papyrus, an ancient Egyptian medical text dating back to 1550 BC, describes applying moldy bread to infected wounds. This wasn't a random act. They observed that the mold seemed to help clear infections. Your ancestors might have noticed that certain wounds healed better when exposed to specific molds, passing down this knowledge through generations. It was a crude, uncontrolled antibiotic, but an antibiotic nonetheless. Consider also the case of Otzi the iceman, a Neolithic man whose perfectly preserved body was discovered in the Alps. Among his belongings, Otzi carried two types of polypore fungi. One, a birch polypore, has known antibacterial properties and was likely used as a laxative, an anti-inflammatory, or even as an internal antiseptic against intestinal parasites. The other, a tinder fungus, could be used to start fires, but also possessed medicinal qualities, including acting as a styptic to stop bleeding. Otzi was, in essence, carrying a portable, natural first aid kit, a testament to the sophisticated understanding of plant medicine prevalent thousands of years ago. What about something as common as a toothache? You might dread a dental visit today, but imagine the agony of a rotten tooth in an era without modern pain relief or skilled dentists. Archaeologists studying ancient human remains have uncovered surprising evidence of early dentistry. Researchers from the University of Bologna, including Dr. Federico Fanti, examined a 14,000-year-old human jawbone found in Italy. This jawbone showed clear evidence of a decayed tooth that had been painstakingly scraped and cleaned with flint tools. Furthermore, the cavity was packed with a filling made of bitumen, plant fibers, and hairs. This wasn't just a crude attempt. It was a deliberate, complex procedure to alleviate pain and prevent further decay. Your ancestors were enduring painful, intricate dental work at a time when you might think they were simply pulling teeth. Let's reconstruct a concrete scene. Imagine yourself crouched in a dimly lit cave, the flickering light of a fire casting dancing shadows on the rough stone walls. Your child, perhaps a toddler, writhes in pain, clutching their stomach, their body racked with fever. You've tried everything you know, but the illness persists. A local healer, a wise elder whose hands bear the scars of countless remedies, approaches. They don't have a stethoscope or a thermometer. Instead, their tools are a collection of dried herbs, a poultice of crushed leaves, and a small, smooth stone. They chew on a bitter root, then press the resulting paste to your child's lips, murmuring ancient words. They might prepare a tea from willow bark, which contains salicin, a natural precursor to aspirin, or they might apply a dressing of wild plantain leaves, known for their anti-inflammatory and antiseptic properties, to a festering wound. The air is thick with the smell of smoke, damp earth, and unfamiliar botanicals. You watch, hope and fear warring in your chest, as your child slowly, miraculously, begins to calm, their fever receding. The counterintuitive twist in all of this is that the craziness of ancient medicine often stemmed not from ignorance, but from acute, iterative observation. Your ancestors were not just superstitious. They were pragmatic, empirical scientists in their own right. They tried things, observed the outcomes, and refined their methods over countless generations. The knowledge wasn't codified in textbooks but passed down through oral tradition, through the hands of healers and shamans. They learned which plants eased pain, which substances stopped bleeding, and which procedures, however brutal, offered a chance at survival. Many of the miracle drugs in your modern medicine cabinet, from aspirin to certain antibiotics, have direct ancestral roots in these ancient discoveries. The active compounds were isolated and synthesized, but the initial insights came from your predecessors, carefully observing the natural world. Think about your own life today. How readily do you reach for a pill to cure an ache or an ointment for a cut? You trust in modern medical science, often without a second thought about the millennia of trial and error that paved the way. Your body's incredible capacity to heal, to fight off infection, to recover from injury, is a legacy passed down from ancestors who faced far greater threats with far fewer resources. The placebo effect, where belief in a treatment itself can trigger healing, was a powerful tool in the hands of ancient healers, just as it remains a confounding factor in modern clinical trials. Your connection to the natural world, to the plants and substances that can alleviate suffering is an ancient inheritance, often forgotten in your concrete jungles. The next time you feel a throbbing pain in your head, consider the incredible resilience and ingenuity of your ancestors. The brutal, desperate measures they took to survive were not always crazy after all. They were often the first, foundational steps in a long, winding journey of discovery that ultimately led to the comfort and safety you experience today.